Imagine that it's a Monday morning and you're running late for your morning meeting. You're on the train and you feel stressed because you can't afford to be late for work again. But there's nothing you can do about it. You arrive at the office and in your morning meeting, your boss asks you a question which you don't have an answer to. Suddenly, you feel your jaw clenching, cold sweats dripping down your chest, muscle pains, and your vision starts to get blurry. Take a deep breath. It's going to be okay. This is your body's response to stress. Hello, I'm Dr. Tay Kai Hong. I'm a medical doctor and a psychiatrist at Private Space Medical.
And I'm Joy, a pharmacist from Watsons, and today we'll talk about stress
and how to manage it.
So stress is part of life. I believe everyone experiences some form of stress in their life. So what is exactly stress?
Right. Stress is our body's natural response to environmental threats, things that we perceive to be dangerous. Imagine running along a park and then an animal charges towards you. Right? It causes our body to produce stress chemicals to prepare our body to protect ourselves. Some might call it a fight or flight response, which is basically a stress response.
Yeah, so during this stress period, our body will release hormone cortisol as well as adrenaline, which cause increased heartbeat. But I will heard people say that I feel stressed but I feel good. Is it possible?
So actually what you described is a positive stress, or what we term as eustress. It can be a positive driving force in our life to help us to achieve and to put in effort in our life projects, in school and in our work. Yeah. But of course, when stress reaches a certain threshold beyond what we can cope, then stress becomes bad stress or distress. Joy, what do you think causes stress?
I think anything that we care about will cause stress, be it our personal life or family or work. They are extrinsic as well as intrinsic stressor. Intrinsic stressor is about our own mindset as well as expectations towards things. External stressor is something beyond our control, for example, major life events, urgent deadlines. Yeah.
Right. Yeah. What I've noticed is that during the periods of life transitions, for example, changing schools, changing jobs, getting married, moving to a new place. These are the periods of life where also the levels of stress tends to spike, where we have to actively adapt to the changes that life brings about.
I see.
It's an interesting point about intrinsic stress, because if a person tends to be more pessimistic, tends to be anxious and overthinks about problems, he or she can also be more prone to stress than more positive, optimistic people.
Yeah. So for that, I always remind myself to stay positive in situations of uncertainties. I think that will help to manage stress. What are the signs and symptoms of stress?
Right. Yeah. We can group it into physical symptoms and psychological symptoms. Stress really affects the whole body, right? So you can imagine having giddiness, lightheadedness. When it affects the heart, we can feel chest tightness or palpitations, right? We can hyperventilate or feel like we are short of breath. We can also feel like our stomach is churning, right? Or some people even vomit when they are under immense stress, right? And these are the physical symptoms of stress. The psychological symptoms might include insomnia, muscle fatigue, feeling very lethargic,
loss of concentration.
Yeah. And it also affects the immune system, and people tend to fall sick more often when they are under chronic stress.
Yeah, and most of the time they do not realize all these symptoms are associated with stress, then they blame on other things as well.
Yes, exactly. I've had patients who go around seeing different doctors thinking that they have a muscle problem because of muscle aches, but it turns out they are suffering from maybe anxiety disorder or they're under chronic stress.
I see. What happens if stress is left untreated?
We can imagine stress as like a stream of water falling into a bucket, and there will come a point in time where the water overflows, and that's where our body and our minds, the system is not able to cope with that level of stress anymore. Right? Either the bucket has to expand or the water has to slow down. Right? It can lead to physical health complications such as diabetes, obesity, and increased risk of heart disease and stroke, high blood pressure. Right. It can also lead to mental health complications like depression, anxiety, and insomnia.
Stress can also lead to unhealthy coping mechanism, for example, binge drinking, smoking, gambling, comfort eating, etc.
Yeah, this is what we see in our clinical practice as well. and it's advisable to seek help if one is suffering from high levels of stress for more than a few weeks, to the extent that it starts to affect their daily life. For example, it might affect their sleep, their appetite, their ability to function in school or at work, and it's starting to affect their family life. Right? That's the point where we advise the public to seek help.
So, Dr. Tay, what is the best way to manage stress?
Right. So if stress is a stream of water entering the bucket, there are many ways that we have to try to increase the capacity of the bucket so we can take on more stress in our lives, right? How do you manage stress, Joy?
For me, definitely exercising. I will make sure that I exercise at least 5 times a week. And also, I always remind myself to stay positive during times of uncertainty. How about you, Dr. Tay?
I'm not always able to remind myself to stay positive, and sometimes I need my loved ones and friends to remind me of that. So staying connected with my friends and family are a key way for me to manage stress.
Alternatively, public also can consider supplements that has been associated with reduced symptoms of stress. For example, rhodiola, ashwagandha, and kawa.
Yeah, I've seen scientific evidence that some of these supplements can help to relieve muscle tension and improve fatigue.
I see. How about pharmacological ways?
In terms of medications, we try not to medicate stress away because stress is really a part and parcel of life, right? However, if chronic stress leads to mental health complications like depression, anxiety disorders, panic attacks or insomnia, one might benefit from medications to manage some of these symptoms.
Yeah, that's why it's very important to seek professional help if you feel that you are overwhelmed with stress.
Yes. In our modern, fast-paced society, stress is really inevitable.
And healthy amount of stress can push you to the optimal level of alertness, behavioral, and as well as cognitive performance.
However, chronic stress at a high level can cause detrimental health complications.
And you might be overwhelmed with stress without realizing it.
If you or your loved ones are experiencing high levels of stress for extended periods of time, please consider seeking help from healthcare professionals such as psychiatrists or counselors, and they will be able to provide you with the tools and resources needed to manage your stress better.